Good morning. My name's Peter Schneider, and I've got here with me for the next little while Niten Singh. And Niten is a vascular surgeon in practice in Washington, and we're going to find out a little bit more about his practice. So Niten, I understand you just recently left Madigan Medical Center and moved over to University of Washington. Tell us about the transition. Tell us about what you're going to be doing in the faculty at University of Washington.
Right, Peter. So I left Madigan. I was in the Army. I had an obligation to the Army after my training, and we started this program at Madigan called the Limb Preservation Program, which is what we'd like to continue at the University of Washington. And so I transitioned in July, and there's a lot of challenges, but I think there's a lot of promise with it as well. One of the things we're doing is starting a whole group of multi-specialty folks that are going to get together, and we're going to try to put this team together to really see if we can come up with a true limb preservation service, which is difficult. A lot of times people will think about interventions, but having a surgical podiatrist, having another interventionalist, having the physiatry people and the orthopedic guys, I think that is the true service that we're trying to create. And we just started, but we've had some successes, and I think there's a lot of potential.
Now, when you were in the Army over the past few years, you must have been faced with a lot of challenging, complex limb problems from the wartime that we've had over the last number of years. Did you learn anything from that experience that's going to help you now with this limb preservation program?
I did, and I think a couple of deployments that being in Iraq a couple of times, I think that has really, allowed me to just understand the soft tissue aspect of amputations and trying to preserve a limb as best you can. One of the big differences is that the patient population in war is young and healthy. The vessels are generally healthy, and you can do a lot of things to these patients, or these patients will undergo an amputation and then do quite well. I think, as we all know, our patient population in vascular, they don't do as well with an amputation, and I think trying to avoid a major amputation and keeping it to a minor amputation is one of the real keys that you see in our patient population, which, for the young soldier that has a devastating injury, oftentimes the best option for them is an amputation. But in our patient population, that's not true.
Mm-hmm, mm-hmm. And is this because amputation in the maybe more elderly, diabetic, vasculopathic group, they're less likely to ambulate? Is that?
Absolutely. Our patients, they won't get a prosthesis, mm-hmm. or many of them won't be able to do the rehab to get a prosthesis. And so, it's a devastating kind of issue when you have an amputation in our patient population. Whereas a young, healthy soldier that gets an amputation, oftentimes you'll see those guys, even with a high above knee amputation, being able to get a prosthetic leg and be very active in life. But I think it made me appreciate our patient population more and understand the big differences between patients that undergo, young patients that undergo an amputation versus our patients.
Mm-hmm. So tell me now, with this limb preservation service, will it include both inpatient and outpatient component, or will it only be for those patients who are sick enough to get admitted to the hospital? How will you do this?
Well, I think as of right now, it'll have an inpatient and an outpatient component. One of the things that we run into is that some patients are identified early, and that's what we're trying to do is get a campaign to have these patients sent to us earlier. And if they have a small wound on their foot, those are the kind of patients that we can get in, and if they need an intervention, be it endovascular or bypass or whatever, we can do it early. And if we do an intervention, then they could be managed as an outpatient with a small wound. Now, many of these patients have worse problems and need to be admitted as an inpatient, and I think that there's a fine line between that, and I think there's a lot of patients with very small wounds that, if identified early, you can prevent devastating issues down the line.
Mm-hmm. So is it possible that if you could identify patients earlier who have these ischemic wounds, that they would be more likely to be treated, sort of treatable, let's say, with interventions than with bypass, or do you think that doesn't really matter, that timing issue?
I think timing is very important. Many of the patients with the large wounds, there are studies showing that bypass for large wounds is probably better than a percutaneous intervention. But it's hard to say, given what these patients usually present with. Oftentimes they're not bypass candidates. But if you can get somebody who has a small wound or even rest pain and treat them, then I think that you can prevent issues down the line. And I think that's the real key, is early identification, putting out the word to the primary care provider and the podiatrists out in the community that see these patients.
Mm-hmm. Mm-hmm. Good. Okay, so now you just recently moved to Seattle, correct?
Correct.
And had you lived in Seattle before?
No, I lived about 45 minutes south in a place called Gig Harbor.
Okay. So, and now in Seattle, so tell us about life in Seattle. What's the most fun or interesting thing you like to do there?
Well, in Seattle it rains all the time, so there's not a lot happening there, but no, I'm just kidding. I think Seattle often is thought of as a place where the weather's pretty bad, but it's one of the most beautiful places you've ever been in the summer, particularly. So there's lots of outdoor activities. Got a group of guys, and we try to tackle some mountains once in a while, which is some fun things. But I also have 2 kids, so I'm pretty tied up in other activities right now, sporting activities and school activities with the kids. But it's as far as Seattle, it's got a little bit of everything. It's got the city life, but 20 minutes away you can drive out and you'll be out in the mountains. You can be out in the water. So lots of activities, lots of great things happening in Seattle.
That's great. Well, thank you very much for spending time with us.
Thanks, Peter.
Right, and